Hello, everyone, and welcome to MSK Unknown Case Series, case number 45. Here we have a frontal AP radiograph of the pelvis in a trauma patient, and I'll give you a second to take a look at what you think the findings are. And of course, the question that I have for everyone is, what is the mechanism of injury here? Is this an AP compression case, lateral compression, vertical shear, or axial loading? What's the mechanism of injury here? So of course, this is a case of AP compression. And what we have here, we have a comminuted minimally displaced fracture involving the left iliac bone that's incidentally noted. And that's not really, that doesn't really lead you to the answer of AP compression. But what does is we have frank diastasis or separation of the pubic symphysis. Now, normally you're allowed up to 1 centimeter of separation or distance before you call diastasis. So anything more than 1 centimeter of separation here would be diastasis of the pubic symphysis. So you always want to take a look and scrutinize the distance here of the pelvis. You should also scrutinize this line here, which is the iliopectineal line, right? A disruption of this line would reflect anterior column acetabular injury. This here is the ilioischial line, right? Right here, right? Ilioischial line. This is the posterior column of the acetabulum. So a disruption of this line would reflect fracture of the posterior column. Of course, you know, it's hard to see here, but this line right here is the anterior wall of the acetabulum, and this here more laterally is the posterior wall of the acetabulum. So disruption of either line will reflect an anterior wall or a posterior wall acetabular injury, okay? These here are the arcuate lines right here. Always important to scrutinize these lines. Disruption of this line will reflect a sacral fracture, right? Particularly a sacral insufficiency fracture. Now, this line here, this is the anterior SI joint, right? You're allowed up to 4 millimeters. Anything more than 4 millimeters separation would be diastasis of the anterior SI joint. And more medially, this line here is the posterior SI joint. Anything more than 4 millimeters would reflect diastasis of the posterior SI joint. Anterior SI joint, posterior SI joint, okay? And I want to talk about the Young Burgess classification of pelvic fractures and pelvic injury, because I think it's really important. This is how we classically classify pelvic fractures. There's 3 types: AP compression, lateral compression, and vertical shear injury. And these are the 3 main types of pelvic injuries that you get based on the mechanism and the direction of the force that's applied to the pelvis at the time of the injury. And as we saw in this case, AP compression is typically associated with diastasis of the pubic symphysis and or SI joints. And sometimes there's pubic rami fractures that are associated with this. Now, the important thing is that if there are, in the index case, there were no pubic rami fractures, but if there are pubic rami fractures, they're oriented in the sagittal plane. Typically, on an AP radiograph of the pelvis, they're going to look they're going to be vertically oriented pubic rami fractures. Okay, very important when we consider the type or mechanism of injury. There's 3 types of AP compression injuries: type 1, type 2, and type 3. AP type 1 is when the pubic symphysis diastasis is less than 2.5 centimeters. So it's going to be greater than 1 centimeter, but less than 2.5 centimeters. There possibly will be pubic rami fractures if they're present. They're going to be oriented vertically or in the sagittal plane. Typically, the sacrospinous and sacrotuberous ligaments are not disrupted. That's in contrast to an AP type 2 compression injury where the diastasis of the pubic symphysis is going to be greater than 2.5 centimeters, and there will be anterior SI joint diastasis. So the anterior SI joint will measure more than 4 millimeters, but the posterior SI joints are intact. And you may or may not have pubic rami fractures. Again, they're going to be vertically oriented or oriented in the sagittal plane. In this case, the sacrospinous and sacrotuberous ligaments are going to be disrupted. A type 3 AP compression injury is when you have diastasis of the pubic symphysis of greater than 2.5 centimeters, but not only is the anterior SI joint diastatic, the posterior SI joint is also diastatic. You may or may not have vertically oriented or sagittally oriented pubic rami fractures in this case. And of course, the sacrotuberous and sacrospinous ligaments are also going to be disrupted in AP type 3, just like they are in AP type 2. Lateral compression is the most common type of pelvic injury in terms of the mechanism of injury that we see in clinical practice. And you're going to have pubic rami fractures, but they're going to be oriented in the coronal plane. So on an AP view of the pelvis, they're going to be horizontally oriented pubic rami fractures. That's a clue that you're dealing with lateral compression and not AP compression. And there are also 3 types of lateral compression type fractures. Type 1 is when you have a sacral impaction fracture plus a pubic rami fracture that's oriented in the coronal plane. A lateral compression type 2 is when you have a crescentic fracture of the iliac bone or diastasis of the posterior SI joint plus coronally oriented pubic rami fractures. And a type 3 lateral compression is when you have a windswept pelvis. So on one side, you have lateral compression injury, either a type 1 or a type 2. And on the other side of the pelvis, you have an AP compression type of injury. So that combination is going to be a lateral compression type 3 injury. And the last type is a vertical shear injury, which is the most unstable type of pelvic injury that you can have. It's typically when you have vertical offset or superior displacement of one hemipelvis with respect to the other. And this results in multiple ligaments that are injured. It has the highest degree of mortality, often associated with vascular injuries. Importantly, this can also be associated with sagittally oriented pubic rami fractures. So just like AP compression, you can have sagittally oriented or vertically oriented pubic rami fractures on an AP view of the pelvis, but look for the vertical offset or the superior displacement of one hemipelvis with respect to the other to suggest a vertical shear injury. Thank you so much for your attention. Tune in next week for another high yield MSK unknown case.